My name is Maury Gertz. I'm a professor of medicine at the Mayo Clinic College of Medicine and chair of the Division of Hematology at the Mayo Clinic. I'd like to review a number of questions regarding multiple myeloma at this time. I'm frequently asked what multiple myeloma is. Multiple myeloma is a malignancy of the bone marrow where cells that are protein producing in the bone marrow begin to grow without restraint and begin to repopulate the bone marrow. Multiple myeloma is a cancer. It involves the bone marrow and is not bone cancer. Multiple myeloma is, despite its involvement of the bone marrow, very different from leukemia, and it's very different from lymphoma, which are other blood cancers that can involve the bone marrow. Multiple myeloma is a rare cancer, and it only accounts for 1% of all cancers. Its primary manifestations are impairment in blood production, which is referred to as anemia. The patient will feel fatigue, a loss of stamina, and a loss of energy. It can cause damage to the normal structure of the bone. This is frequently manifest as bone pain or rib pain or pain with coughing or sneezing due to bone destruction. Occasionally, proteins produced by the multiple myeloma cells can produce damage to the kidney. When seeing your physician, the key questions include what the treatment plan would be, what specific tests are planned to assess your specific myeloma status. You would like to know how your blood is, how your kidneys are, and what your bone structure is like and whether you are at risk of any specific bone damage. In addition to the primary treatment of the cancer, there are questions about whether any specific supportive treatments are required to help maintain bone mineral content, as well as whether specific medicine is needed to help manage any anemia complications or low blood count. One thing that is certainly true about multiple myeloma is there's no cookie-cutter approach to management, and no one treatment is right for all patients, and ideally, treatment should be specifically tailored to a patient's clinical situation as well as their own personal preferences and needs. Parameters that are important in gauging the various alternatives include patient's age, their activity level and how robust they are, whether they have significant impairment of kidney function, and the extent of their bone disease. Treatments for multiple myeloma vary. Some patients require radiation only as a treatment. Many patients will require, in addition, chemotherapy, which can be oral or intravenous, and a significant proportion of patients often receive stem cell transplantation as part of their therapy. General guidelines can't be made as to which patients are most suitable. Those would require individual discussion with your physician. Stem cell transplantation is a method whereby high doses of chemotherapy are administered to effect a greater destruction of the cancerous cells in the bone marrow. But this technique is associated with higher side effects, the necessity for hospitalization, and a significant risk of infection. Over the past 5 years, there have been dramatic changes in the management of multiple myeloma. A number of new drugs have been developed, and these are drugs that can be discussed with your physician. Some of these drugs are oral, some of them are intravenous, and have changed the landscape for the management of multiple myeloma. Some of these agents are used only after other treatments have failed, but recently some of these agents are also being tried very early in the diagnosis of this disorder. This also would need to be discussed with your doctor. One important aspect regarding treating multiple myeloma are the clinical trial. Clinical trials are studies where new treatments are tested for patients with multiple myeloma. Many patients will be eligible for clinical trials, and it is specifically worthwhile asking your physician whether you would fulfill eligibility for participation in a clinical trial. The treatment of multiple myeloma today has changed dramatically from the treatment of this disorder only 10 years ago. It's important to be very cautious in interpreting statistics that are widely available on the World Wide Web. Statistics on response and statistics on survival may not be applicable to any individual patient's multiple myeloma, and because of the progress that's being made, outcomes today are substantially better than they were 5 to 10 years ago. With the refinements that have been developed in transplantation, reducing the risks to the patients, and enhancements following transplant to help maintain the response, as well as the introduction of these new novel agents, the prospects for patients with multiple myeloma are dramatically improved. At the most recent American Society of Hematology meeting, over 200 scientific papers were presented from scientists all over the world whose single goal is to improve the outlook and the survival and hopefully achieve a cure for patients with multiple myeloma.